I'm Dr. Shoukat Ali, ENT consultant, MD Health Center. I just want to give a public service message for the common ailment of nasal cavity. The most important and the most common disease which we face normally is the blockage of nose. Either one nostril or the other nostril, they get clogged up, and patient has to open the mouth and breathe from the mouth instead of nose. There are few reasons for that. The first reason is DNS, that is deflected nasal septum. The second one is inferior terminal hypertrophy. There are three types of glands into the ear: superior, middle, and inferior. The inferior glands they get hypertrophied and they produce the nasal symptoms. The third one is nasal polyposis or nasal polyp. These are new glands which are produced into the nasal cavity and they block the airway passage. And the fourth one is chronic maxillary and frontal sinusitis, what we normally call Raya, that gets into the nose and they get clogged up and the patient feels difficulty in breathing. As far as the deflected nasal septum is concerned, that is right from the beginning of the childhood. When the child is born, this thing, septum, because of the different reasons, they get deflected at one side. But we only label a patient suffering from deflected nasal septum when it produces symptoms, a blockage of nasal cavity. That is one thing. Second is inferior terminal hypertrophy. There are different reasons for its enlargement, and the basic one is the allergic inferior terminal hypertrophy. The other one is the bacterial or viral. The third one is polyposis or nasal polyp. Point is that this nasal polyposis only develops because of allergy. There are different allergens into the air, into the environment we are working with. Anything can cause allergic reaction, and as a result of that, we get polyposis or nasal polyp. And the fourth one is chronic maxillary sinusitis. There are four sinuses: the frontal one, the ethmoid one, the maxillary one, and the sphenoid one. The maxillary sinus is the main sinus which produces Raya, what we call in the local language. Their drainage is clogged up, so nasal blockage occurs and the patient don't feel comfortable in breathing. Now, as far as the treatment is concerned, there are medical treatment and surgical treatment. Medical treatment envisages like antihistamines. These are the drugs which reduce the production of sputum. The second one is antibiotics. If somebody is suffering from bacterial sinusitis, we give antibiotics. And then there are inhalations and supportive treatment. If the patient is suffering from blockage of nose for more than 1 month, or these different type of the remedies, they don't do anything and they fail to redress the problems, we can start thinking on the lines of curing the things by surgery. Either by deflected nasal septum is done by SMR, submucous resection. Inferior terminal hypertrophy by inferior turbinectomy, we reduce the size of it by surgical maneuvers. And the third is polyposis. We remove the polyp so that the nose is open. And chronic maxillary sinusitis, we make a big hole, and that is known as intranasal entrostomy, so that the sputum does not clog up into the septum. These are the different things. I normally see patients at MD Health Center. If you have got any problem regarding the nose, you can always contact me here. And if there is a surgical remedy, we can always arrange for that. Thank you very much.